What led me to Unity Point Breast and Bone was a mammogram. We had just moved to Cedar Rapids, Marion. I had learned from my mammogram that I needed to come in for an ultrasound. I have been called back before. Didn't think much of it at the time, but I was new to Unity Point Breast and Bone, new to the area, so my nerves were a little bit heightened. About halfway through is kind of when I started to have a gut feeling that this was indeed something potentially serious. If you had to put this into a percentage, what percentage would you give the likelihood of this being cancer? And he said 97 to 99% sure it was cancer. But I remember coming out of that appointment going, okay, let's buckle up. This is happening. After that ultrasound, I went in for a biopsy, and after those results came in, Mona, the care coordinator, called me with the results.
Care coordination is just the process of a patient. In my position, it could be from the starting point of there being recommended to have a biopsy, a breast biopsy. So getting them set up for that. And then the next steps of notifying them of their results. And if they're positive, what are we going to do next? Setting up with a surgeon and an oncologist.
And through much deliberation on our end, we as a team decided a lumpectomy. So that's what I ended up doing.
With breast cancer, genetic testing is often suggested, and she wanted to proceed, so we did get that appointment set up with a genetic counselor.
The Genetics and Risk Assessment Clinic at the Community Cancer Center is comprised of 2 nurse practitioners who are able to meet with patients and sit down and discuss if they have any personal or family cancer risk that might be beyond what the general population has that could impact if they need to undergo additional cancer screenings now or in the future, and if their family might need to undergo additional cancer screenings now or in the future.
We, in that appointment, learned of the diagnosis, the SDHB deletion. It wasn't until I met with Dr. Buntinas where we realized how serious this genetic mutation was. We look at what this possibly means for your future and what you could potentially have within your body, because the SDHB deletion causes neuroendocrine tumors called paragangliomas and pheochromocytomas.
In Leslie's case, we identified a rare gene, not a common gene. It's an SDHB mutation that did not predispose her to getting breast cancer, but was going to put her at risk of developing other abnormalities. So knowing this mutation then helped to identify that there's a very particular, according to our national guidelines, screening and monitoring that needs to occur when you have this mutation.
From my very initial potential diagnosis with Dr. Buntinas, I went to an ENT where they did indeed determine me to have a paraganglioma in my abdomen and also in my neck within my carotid artery. Just going through the removal of my abdominal tumor, I am now down to 1 tumor in my neck. I would not have caught this abdominal tumor had I not gone through breast cancer. As hard as the journey was, I'm thankful for it, because that tumor could have been life impacting. It could have taken years off my life, metastasizing, and because of my breast cancer journey, it didn't. It's out. That last day was a day of celebration. I got to ring the bell, and that team was there to celebrate with us, and I couldn't have done it with a more deserving team than the Helen G. Nassif Community Cancer Center.
Helen G. Nassif Community Cancer Center. Cancer care is all we do.